The first issue here is, what is a relapse? If you ask the doctors what a relapse is, they'll say one thing. If you ask the patients, they'll say all different sorts of things. And that what happens, since the understanding is not clear, the patients don't get to the doctors to talk about relapses very much. They're talking about their disease-modifying therapies and their bladder problems, but they don't get to talk about relapses very much because they don't know how to really frame the questions and frame the issues. And if we can get some message today, would be how to increase the doctor-patient communication around relapses, because relapses are really important. The doctors define a relapse very specifically. It's a neurologic problem that I can see on my examination and quantify on my testing that lasts at least 24, maybe to 48 hours, and there's nothing else intervening that may be causing those same symptoms, like a bladder infection may cause the same symptoms, but that's really transient. So these are more longer lasting. And I'm very clear about that. If you ask the patients, if they've had a bad day, if their kids have given them a hard time, if they've been overstressed at work, I'm having a bad day, they might call that a relapse. But there's nothing objective on the examination for the neurologist. And so after they talk to the neurologist a few times about, I had 6 relapses this last 3 months, and the doctor says, well, you don't know what a relapse is, but if you ever really stop walking, let me know. Well, there's a happy medium in between there. And I think one of the most interesting studies that I have seen ended up in a sort of a YouTube movie. It showed what happened to people who were not having relapses, but they had regular MRIs taken. It was like the 4th of July. These sparkles of brain lesions here and brain lesions here and they would come and go. And you play it in a movie, it looks like you're in the 4th of July parade. That's that much damage. These patients were not having any symptoms. So with these obvious areas of damage to the brain that did not cause symptoms, are they really a relapse? Should they be treated? If you don't treat them, are you going to have more problems later because they didn't get to treat the damage that was occurring as it become permanent? It complicates it because those relapses contribute to the overall damage of the disease. And so we want to stop the damage long term. We do that with the disease-modifying therapies. However, if we can stop the acute damage as well, as soon as it's happening, we're going to help the long-term damage. So it's really an important issue to look at both the long-term disease-modifying therapy agents and the short-term treatment of relapses. We're learning more about relapses, and we have standard therapies and we have newer therapies for relapses, and that's really a decision between the doctor and the patient. And it's complicated sometimes as far as side effect profiles and whether you have to be in the hospital or whether you can do it at home. But all those things come in that conversation once you start talking about the importance of identifying relapses and treating the ones that you really feel are important.